In this, one of Britain's hardest hit ICUs, the worst of the pandemic isn't behind them, it's just happened.
We've also had 8 deaths. It's been the worst weekend that we've had. And that's the problem, because you have a death and unfortunately there's somebody to go in that bed. Change mattress, next patient.
A third of the COVID patients in this ICU have died since Friday. There are 197 total in the hospital, 30 new this weekend. Outside, the northern city of Blackburn last week had the worst rate of new infections in England. What's extraordinary is just how frenetic, how busy this ICU ward is.
So on Sunday afternoon, it was literally patient in, stabilised, but it was almost doing traffic control to make sure that they weren't banging into each other when they came in.
The pandemic never really eased for summer here. They're exhausted by only 2 weeks since March without a COVID patient.
And it's when I see those very senior, experienced nurses, it's when I see them crying. It's when I don't really have an answer, but it's when they say, yeah, but when? When's it going to end? When are we going to get back to some degree of normality?
But they are also exhausted by a general public disobeying and angry at the rules.
You know, we've given absolutely everything, and yet we're being called liars, and we're being abused on the phone, and there's nurses withdrawing treatment on patients and doing end of life on a Zoom call, and having a wife or a husband or a daughter on the other side of that camera crying and saying, please will you hold my dad's hand, please will you do whatever, and then the next telephone conversation might be somebody hurling abuse down the phone at them. Unfortunately, on several occasions we've had to stop the Zoom calls because there's been numerous relatives in a room, not social distancing. The other day there was at least 45 in a room, so we had to stop it.
Better treatments keep the patients conscious now, able to talk clearly of how dangerous the disease is. Retired carpenter Jack has no idea where he got it or why people insist on breaking the rules.
Ridiculous. I just can't understand that, why they do it. They have no idea of the consequences of it, you know.
It really does weigh you down when patients in work are really unwell and dying in a very specific way, and yet there's people who know nothing about the virus saying that it's not real and it doesn't exist. Yeah, last weekend on my nights, as soon as I arrived here, a lady had come to the ward and unfortunately passed away almost immediately. You know, giving some relatives a bag and a stick of a lady who has passed away in the bed in front of them. It's quite difficult. It's difficult for them and it's difficult for us as well.
While outside may seem to want to be less aware of the disease, inside they grow more aware of its victims' suffering and its stark, random viciousness.
Is there one thing that you've learned about this disease in the last 7 or 8 months?
You can't read it, and I hate it. From the pit of my stomach, hate it.
Nick Payton-Walsh, CNN, Blackburn, England.